Hello, everybody. It's Vix here, and I've seen we've got quite a few new members, so welcome to the Yoga Teachers Lab. I'm a physical therapist, osteopath from the UK, and I've been teaching yoga for 10 years. And lots of you in here have met me either in person or online before, either in teacher training settings and workshops. And I am here to share as much as I can, collaborate as much as I can to help all of us learn more about the human body, about teaching yoga, to kind of like empower us to be more confident and to keep teaching and to keep moving the profession forwards. So today I wanted to address a question that came up on the homepage and the community page here on the lab, in the lab. It was around students that really struggle with kneeling in 4-point kneeling, hands and knees, tabletop, and gate pose, all of those sort of things. And it took me a few days to think about this because I was thinking, well, if they can't kneel, that is quite a big problem for a lot of people. Because when it comes to our class plan, when we're sitting down to sequence, it's really hard to sequence a regular, well-balanced yoga class without kneeling. And of course, if you're working one-to-one with somebody who can't kneel, that's much easier because you can make the plan really suit just that person. But when it's a group class, and let's be honest, sometimes we have 30 people in front of us, if we know that one person can't kneel, it's going to be really difficult to keep them included and still give a well-rounded class to everybody else. So although it took me a few days to have a think about it, had a bit of a busy week anyway, I've come to the conclusion that we just need to have a little talk about, first of all, why people can't kneel, and maybe even challenging the idea that they can't kneel and figuring out what's going on there. Have they got, for example, number one, if somebody can't kneel, why is that? The most obvious answer is a knee injury. And with a knee injury, if it's an acute injury that's happened in the last 3 months, it might be a ligament damage, meniscal tear, or some kind of pain, or some kind of injury to the patella tendon, then this will heal. And of course, if they have been told by a doctor, physio, osteo not to kneel, then they shouldn't. But some people get a bit of discomfort in kneeling with an injury where the kneeling itself won't be making it any worse. So with the person that gets a little bit of pain kneeling and has an injury that isn't serious, so it isn't like they've had a surgery or they've had something removed or they're going to have something removed, or it's osteoarthritis. If it is just somebody who has a sore knee and the injury is soft tissue, then I would first of all try and pad their knee. So I would make sure that they have a double, triple, even quadruple mat underneath them. So in my studio, we have a ton of mats. So I always double mat everybody anyway, because I think the yoga mats that are like a few millimeters thick are a bit too thin sometimes, especially because if people do have wrist injuries, knee injuries, and they do like to jump around a little bit, it's just, if you do that for many years on a hard floor with a tiny mat, I think that there's probably a good chance that you might end up injuring eventually yourself. So looking at the padding underneath, what are they actually kneeling on? And then of course you can look at buying props and stuff that will help them to kneel comfortably. So you can get these little knee rounds, like silicone rounds that they can kneel on, and they're available in lots of different shops that do health and wellness gear. So that's what we can look at first, is before we actually start modifying the whole class and worrying about how do I redo this whole plan for the person that can't kneel, let's have a look at why they can't kneel and question that and see. If we look at the anatomy of the kneecap is a free floating bone that sits in the patella tendon and ligament. So it's called ligament and tendon because part of it is muscle to bone and part of it is bone to bone. So the bit that comes over the knee from the quadricep, from the thigh, over onto the patella, that section is more a tendon because it's muscle bone, and it's from the patella, middle of the patella to the shin bone, that is more of a ligament as it connects the bone to the bone. So if we look at the anatomy, that patella sits on there, and the patella is a type of joint like a floating joint, but it does have the cartilage at the back of the kneecap. So quite often with people that kneel a lot for work, you can get long term, it doesn't happen, I don't think, unless you have a bad accident where you fall on your knee, you don't suddenly get a wear and tear or like an arthritic or a degeneration of that cartilage just on a Wednesday night. It would take a very long time. It would be also a little bit genetic. It'd be definitely looking at body weight, diet, lifestyle, exercise levels, and what they do with their knees. So, plumbers and anyone that does kneel for work a lot, they tend to get some more they get more issues at the back of the kneecap. So there's a few really fun names for some of the injuries that these people get. We call it housemaid's knee. Oh, I hate that. There's also runner's knee. Runner's knee is also to do with the patella tendon, ligament, patella soft tissue coming over, and it can be an overuse injury of that soft tissue because of perhaps a running style or overdoing running. And to talk about running is a really interesting, an interesting one that we'll do separately. Lots of people, especially as we come into the new year, they think, oh my goodness, I'm just going to start running. I'm just going to go from sitting on my couch or working 8 hours a day at a desk to let's just do 5K every day or every other day. And what can happen there is you're totally overload all of those tissues. Wherever you are at the moment, you have a threshold at which your tissues, your joints, your muscles will say, hey, I'm really fatigued now. And if you are going to go from wherever you're at now to a much more intensive training, quickly, you're going to really stress some of those tissues. So we always recommend with running and knees to train slowly and add as you go, and also to weight train and get the muscles and bones and everything that you're working with during the running to ready for that impact. So working alongside running training, you want to also weight lift and stuff. So that's just a tiny bit off topic, but that's to do with the knees. So we see that with kneecaps. So kneecaps, people that kneel a lot, and usually people that have anything going on inside the knee. So inside the knee, we have soft tissue, we have ligaments, we've got the meniscus, the shock absorber. That one's horizontal. It sits on top of the tibia bone, so on top of the shin bone right there. And it's the shin bone and the thigh bone that come together to make the knee, and it flexes like this and extends. And the meniscus is horizontal in here, two pieces, medially and laterally. So those are ones that can be injured. And if you have an injury to either the ligaments that cross in the middle of the knee, this is right inside the knee. So if you were to take my knuckles as the knee, and this is me bending the knee open, and we just look at the top one there, which is your thigh bone, we have two ligaments that attach the bones together like that from the middle. They cross, ACL, PCL, so the anterior cruciate ligament and posterior cruciate ligament. So these are big, strong structures, again, that can be damaged. And usually if it's happened acutely, so if it's happened quickly, it will probably be a running injury where they've stopped and they've turned too quickly, or a sporting injury, same again, running, you run, you stop, you suddenly twist your knee, or maybe a tackle where someone's come in and tackled you. It might be a ski injury. And of course, those exact structures can also suffer with degenerative factors like it can be underuse. So we get degenerative meniscus, degenerative ACL, degenerative tendons and ligaments. So we usually won't injure those as such in a general yoga class unless somebody really goes into like a lotus position and then really pulls their leg. They really pull their foot to get that foot up on the thigh. If you were to do it quite vigorously, you arguably could hurt those strong inner knee structures. But usually, in most cases, it's going to have taken a long time to get to where they're at. If it starts to hurt at, say, the age of 50 or the age of 40, something has been building in that knee for a long time, unless there was an accident. Of course, falling, twisting, being tackled, slipping on the ice and going down and twisting the knee, that kind of thing. These things can break bones. Of course, they can also damage these soft tissues. So these are some of the common things that happen. You've also got ligaments on the outside of the knee. So we've got we talked about the patella at the front, and then we've got the side ligaments. They can also get pulled. Often when you see those injuries at the ACL, PCL, or meniscus, you also see other ligaments involved. So if they've stopped really suddenly on a pitch and they've twisted, you're going to see a bit of a combination of maybe up to 3 of those structures all being injured at the same time. So these people wouldn't want to kneel. They wouldn't like kneeling. The plumber who may have knelt for a long time, knelt, that is the right word for past tense, isn't it? Knelt, yeah. They might get some degenerative cartilage damage on the back of the knee. But anyone else who hasn't so much injured their knee like that, or done anything else to damage any of the structures, they probably won't damage it further doing a kneeling position on a good supportive mat. And I would triple the mat, or put some, the nice Pilates mats that are thicker, or buy one of those knee pads. I often thought, why don't they invent yoga leggings with knee pads in them? It must exist. We've got to check that. So that was my first point. Why can't they kneel? Let's find out if we can get them kneeling comfortably, without just straight away just taking that first statement and thinking that's it, this person can't kneel ever again. I think I just need to mention knee replacements really quick. So knee replacements we will talk about again separately, because that's a big one, but that'll be another reason why kneeling won't be so easy. In fact, that one is quite tricky, because with a knee replacement, they do lose the ability to fully flex the knee. So it's really hard to get them down into child pose and things like that. And modifications are really important. When part of the knee is no longer human tissue, it means that also a lot of re-education needs to happen around the muscles and tendons that wrap around that replacement. And they might just find it very uncomfortable to kneel. And so with that type of person who's had a knee replacement, I would definitely look at the really thick mats and knee pads, and then perhaps have a one-to-one with them to try and figure out whether kneeling for them is possible going forwards, or whether we need to come up with other variations, which we can talk about in a moment. So I think the main point there is it's really difficult in a group class to give a modification for kneeling, because in a way it's a whole group of asana. The whole style of practice is like face down on the knees, or on the knees in general. Let's move on to talking about a few variations that might work. So the question was about hands and knees specifically. We can definitely perhaps, if we're doing like a thread the needle type pose, we could definitely have them straightening perhaps the leg that is painful. Maybe it's the right knee that doesn't like kneeling. So you could possibly do 3 points of contact as a normal hands and knees position, and then the bad leg can be straightened out. Perhaps then the toes can be like touching the floor, leg nice and straight, and that might help. And then, of course, I think tucking the toes and activating the deep core and pelvic floor muscles will take weight off of our knees. So maybe even trying to figure out whether it would help that person enough to start by tucking the toes in the hands and knees, then start and even practice lifting the knees and dropping the knees down, and then asking them to start thinking and being aware of the muscles involved in holding the knees very lightly on the floor, so barely touching but just about touching, and maybe like getting them to work a little bit through that position, just to take a little bit of weight, more awareness in lifting. And I think the pelvic floor, the TVA muscles, the core, a little bit of pelvic stability will help to take some weight off of the knees. And of course, they can also do some of the stuff that we do in hands and knees. They can lie on their front, and perhaps just go for more of a crocodile style, just lying on their front. If you're doing if you're doing like a bird dog, which is where we reach one arm forwards, one leg backwards, that one can work quite nicely lying on the belly. So they might then reach one arm forwards and then lift one leg away from the floor to get that modification. But it is definitely a tricky one in a group class, teaching a person that really can't kneel. So a couple of modifications for hands and knees. For gait, gait is where we've come up and put almost our entire weight through the knees, and then we're even taking one leg out to the side and straightening that leg so that that knee that's still bent and on the floor is taking all of our weight. So in the presence of an injury in that knee, say it's the left knee and the right leg is in gait, that would be a contraindication, I think, if there's a proper knee injury. If they are going, if they've had a joint replacement, if they've got a meniscus tear, an ACL injury, a patellar tendinopathy, any of the injuries that are kind of definitely inflammatory, or there's something going on in that knee, I would say don't do the gait. You can also, of course, go back to the beginning of this talk where we, pad it, check it out, see how they feel, but get them to really be honest if it is just going to be pinchy and painful. And the thing with knees is, in many poses, we shouldn't feel the knees. So in a pigeon, in a lotus, in tree, we shouldn't ever feel our knee twisting or hurting. Not like we do the hip. The hip's different. It's a ball and socket. So when we put it into a position like pigeon, we're going to be changing the position of all the soft tissues. It's going to slide in its socket like this quite happily, quite happily. So it's all those soft tissues around the hip that are going to get stretched or shortened, lengthened, shortened. So that's fine. It's fine to feel the hip. It actually isn't great to feel the knee twisting or pinching or anything. So it's teaching people full awareness of what's happening in that joint. Definitely with any kind of knee injury, just avoid, even for the love of yoga, just avoid recreating the symptoms that they already have in that knee, because that's not good. If they're healing from a soft tissue injury, let's not pinch it, let's not pull it, let's not twist it at all. Let's give them really good rehab exercises. And I say this to you as a yoga teacher, you can incorporate that into your class. And I sometimes use a patient that I've seen, or for you it's maybe a student comes to you with an injury. You can just weave some exercises into your class, into your group class, that would be good for them, because everybody can benefit from some knee strength and some hip strength and some mobility. So with the knee joint, in conclusion, modifications are possible, and making them comfortable using more padding is possible, but let's not exacerbate symptoms in knees when knees are sore. We can activate more muscles, deep core muscles, pelvic floor muscles. We can hover the knees above the floor. We can modify it like that. But if that person's knee is hurting in hands and knee position and it's quite pinchy and it's painful, I'd say we need to get them off the knee. Knees like to heal by being offloaded. Well, that's not true, actually. Knees love to be loaded, but not in a twisting or in a weight-bearing fashion. It will be lots and lots of, gentle squats, firing up quads, hip flexors, glutes, all of that stuff. We don't want to be pinching knee injuries or pulling, pinching, twisting into those injuries whilst they're healing. Knees can take ages to heal. Tendons can take ages to heal. That's the honest truth. It's not a 2 to 3 week thing if you have a proper tendon injury. If it's properly inflamed, depending on your age, it can take up to a year for a real tendinopathy to heal. And that's with rehab. It can be a bit less than that with good rehab and a good management, but yeah, it can take time. Gait, I wouldn't recommend if someone actually has a proper knee injury, but you can always take it case by case. Take it case by case. There are no blanket statements coming from me in terms of don't do this, don't do it. Really, I think the most wonderful way to approach the human body is case by case, because everybody needs an individual approach. That is the way forwards. But a few key things that I've highlighted here. could help you to know what to do next. Let me know if you have any questions. This has been a, I don't know, 20-minute talk on modifying for hands and knees and knee injuries. Thanks, everybody. See you next time.